Baby-led weaning is such a fun and important topic to talk about, and that's what we're going to be discussing on today's episode of Answers for Families. My name is Tommy. I am your host for today's episode, and alongside me is an incredible co-host, Cara. Cara, could you introduce yourself and tell us a little bit about yourself and what you do here at Children's?
Sure. Thanks, Tommy, and thanks for inviting me here. Today, my name is Cara Larson. I'm the director of the Feeding and Swallowing Program in the Division of Otolaryngology and Communication Enhancement. I've worked at Boston Children's Hospital for 25 years in infant feeding and swallowing, and I'm super excited about this topic today.
Incredible. I know you have a lot of information that's going to help a lot of families out there. So let's just get started. What is baby-led weaning and what are some of the benefits?
Sure. So baby-led weaning came about 2005 by Gil Radley, who first taught us about this topic. So baby-led weaning is a different approach to feeding your baby. So it moves away from traditional spoon feeding and introduces babies to soft, solid foods, and the baby's the active participant, so they're not being fed by the caregiver, they're taking the lead in feeding.
Okay, fantastic. And then what would you say are some of the benefits maybe of it?
Sure. So benefits of baby-led weaning are that the baby is eating what the family is eating. So oftentimes it can be more cost effective because they're eating the meal that the family is. We're just modifying sort of the softness and the texture. That the baby, it promotes sooner independence for the baby with their solid foods. And some studies do show that families who follow baby-led weaning, that the babies eat a wider variety of foods in the first year of life.
Okay, fantastic. And then another question that we get asked all the time is it safe, and then is it recommended?
Sure. So baby-led weaning is safe when we deem that your child is showing the developmental milestones to begin it. So we look at appropriate head control, trunk control, they're sitting independently. We also see lots of patients that may have been born premature or have developmental delays. So in that instance, baby-led weaning may not be a great first choice for them, but maybe they could try it later. And we really want to look at the baby's corrected age if they were born early. But baby-led weaning is safe when you appropriately prepare the foods and the child has one-to-one supervision at mealtime.
Okay, great. So readiness of each individual child is very different depending on that child. And so definitely something to talk to your pediatrician about and make sure that your baby's okay with it. Something I hear often is that you cannot start until 6 months of age, or maybe you can start at 4 months of age. Is there like an age cutoff, or is it more about the readiness?
It's about the readiness, but we really recommend 6 months of age. And we know that with the American Academy of Pediatrics, spoon feeding is recommended at 6 months of age. And same for baby-led weaning, but if your child isn't showing the readiness milestones, it could be 7 or 8 months of age. But whether it's spoon feeding or baby-led weaning, we usually like to wait till 6 months.
Okay, great. And then you touched on this about one study that I think you had mentioned, but a question would be, will this make their child less picky when they grow up?
So in the literature, we find that with baby-led weaning in the first year of life, you can introduce more single foods in different areas, in fruits, in vegetables, in proteins, in grains. Often with baby food, we're a bit more limited. In baby-led weaning, you can steam a wide variety of vegetables and introduce a whole host of different foods that the child, will explore. They may not be swallowing them, but they're licking them, they're munching on them, they're learning to chew them. So there is some research that shows that babies who follow the baby-led weaning approach tend to not be as picky.
Okay, and then what about in terms of allergies? Does it prevent allergies, or should parents be concerned about allergies when they're kind of allowing their child to experiment with foods?
That's a great question, and I always go back to the pediatricians about the allergies and introduction of allergens. However, when you're following baby-led weaning, if the child was avoiding milk protein for the first 6 months of life, before you are going to introduce cheese or yogurt, we should check with the pediatrician. And our top 3 allergens, which would be dairy, peanut, and egg. If there's no risk and the pediatrician gives the green light, we will go ahead and introduce egg. As we know, you can prepare eggs in lots of different ways. And we do now want to introduce peanut butter or a thin layer of peanut butter on a strip of toast or something earlier on.
Yeah, which is fantastic because I love peanut butter. Yeah, and so do my kiddos.
Great protein source.
Yeah, for sure. And something with that, I think with food allergies, if it is of a concern, or especially with the main allergens, to allow them to try one food instead of try 20 different things, and then if they were to develop an allergy, it'd be hard to know which one it was, and so that potentially could be beneficial.
Exactly,
yeah.
Exactly.
And then we were just talking about this, and we said between 4 to 6 months, but introducing foods to our babies and the developmental milestones. Could you go over those key points again about like in a high chair, head control, the key points that when we should start introducing food to children?
Absolutely. So introducing solid foods, and again, we don't want to lose sight that there is some value to spoon feeding, and not everybody will follow the baby-led weaning approach. So spoon feeding still holds an important developmental milestone for babies. But those readiness skills are sitting unsupported, adequate head control. Another thing that we look for as feeding specialists is when a baby starts to lateralize, so move their tongue side to side. And a lot of parents think, well, my baby doesn't have any teeth, they can't eat solid foods. But as we know, the gums are hard enough to pulverize and mash down the food. So lack of eruption of the teeth wouldn't be a reason not to do baby-led weaning. And more importantly is that your baby isn't just moving their tongue forward and back, but they're moving their tongue side to side. That's a really important developmental milestone.
Wow, yeah, I never even thought of that. That's incredible. Thank you for sharing. And then in terms of foods that we introduced first, you've talked a lot about mashing foods. Are there specific foods that you think are best to start introducing?
So when you're following baby-led weaning, kind of our top go-to starter foods would be avocado, a nice ripe soft avocado. Initially you could mash it and then cut it into strips. Bananas, but again, we want to cut everything lengthwise. We don't want to be cutting things into circles. Right. Sweet potato, a baked sweet potato, peel the skin and cutting it into strips. And so we say initially anything that you can mash between your index finger and your thumb, but you want to have it in a stick shape so that the baby can hold it and bring it to their mouth. Because as we know at this age, it's all about hand to mouth and putting in everything in their mouth.
Yeah, perfect. And I've heard some people say like the shape or geometry of almost like a baby carrot, or
yes,
like that stick size so that they can grab it. And then in terms of size, is there a size that's too big, too small, or is it more about the shape?
There's a lot of literature and a lot of people reflect on the size of the adult pinky, which will vary person to person.
Yeah.
But if you think about it, and you look at your pinkies,
yeah,
I feel like that's a pretty good kind of starting point in terms of cutting foods into stick shape. So you do want it to be long enough that the baby can pick it up and begin to bring it to their lips and begin munching and mashing it.
Okay, fantastic. And then what about, a lot of families love to cook with a lot of different spices. Does that matter with baby-led weaning? Is it okay? Should they avoid it?
Yeah, I mean, I think initially we were always thought like, oh, don't give baby spices. But actually, when we think about all the cultural differences and all the different types of cultural foods that families cook, and we don't really want to shy away. And our only thing would be like really spicy foods or something that like we don't want crushed red pepper, right? Or too much like, paprika on there. But putting cinnamon on steamed apples or adding, we don't want to add a lot of salt and pepper, but cardamom or like a light curry or a little bit of Italian seasoning. Really, I think babies like flavor and they like to explore. And I think we have so many amazing foods from so many cultures. And if you talk to different families, they're like, we want to give them what we're eating. So within reason, I think, add the spice.
Yeah, and when we have our children at the dinner table with us, I've experienced it as a parent, I'm sure a lot of other parents have, but we'll try to give our kiddo a food and they just do not want it. So how many times should we try to give the child the same food if they don't necessarily like it?
Right, that's a great question. We get that all the time. And the answer is a lot. I mean, 10 to 15 times of the same food, sometimes up to 30 times before kids will start eating it. So we always like to have sort of their core foods, and in baby-led weaning, if you know that they eat these 4 foods you can bank on, but then the new food, so if it's broccoli spears that you've steamed, keep introducing those at least every other day, and your child, like really over time, will probably begin to explore and accept it, but it's not once or twice and throw it away.
Yeah, 10 to 15 times just seems like so much, but that's what we do, and hopefully eventually it'll catch on.
Right,
yeah,
exactly.
And they'll start to like it. Yeah,
yes.
And taste buds develop over time, so eventually, hopefully they'll start to like the greens and things that they may not enjoy.
And I always feel like, if you could dip it in a little bit of hummus or some type of flavorful dip and use that steamed vegetable sort of as a vehicle, not a spoon, but using it for them to dip it in some flavor to bring it to their mouth, that might entice them to eat more varieties of vegetables.
Mm-hmm. And one of the other questions we had is a lot of kids, especially as they get older, not necessarily for babies, but once they get older, is they graze a lot and they just kind of snack around. They'll eat whatever snacks they find. Is that okay, or should we really just be allowing the children to eat at the meals with us? How should we go about that?
Yeah, grazing can be a really difficult pattern to break, and we really like to avoid it. So we talk to our pediatricians and dietitians who really like to recommend 3 meals and 2 snacks per day. Mm-hmm. Babies need to feel hungry, eat, feel satiated, and then not have any food offered in between so they get hungry again. So if you're leaving little snacks all around the house, as you know, toddlers get into this grazing pattern. It's really hard to break, and then they're not eating a really adequate volume at mealtime. So if we can, we really like to avoid grazing.
Okay, fantastic. Now we're going to go back to some more of the baby-led weaning kind of specific questions and just some tips to encourage solid food. So we were discussing that, between 4 to 6 months, they might be showing some readiness signs, and then once they show some readiness, once they're at that point, should they be eating with their hand? Should they be using a baby spoon, a baby fork? How should they be feeding themselves?
Yeah, that's a great question. I think the most important things for families is that it's going to be messy. So know that your baby's going to get really messy. If you need to, you can take their shirt off while they're eating, put a splat mat on the rug. A lot of people are like, the dog loves when the toddlers are eating because
it's everywhere.
Babies are going to drop a lot of food, and it's just what they do. So in baby-led weaning, we don't want to completely lose sight of the spoon, but a lot of what we do is a preloaded spoon, so that the parents may make a mashed avocado, they'll fill the spoon, hand it to the baby, and then the baby's in charge of putting that into their mouth. So the preloaded spoon is great. Finger feeding is excellent. We love finger feeding, and you don't want to wipe your baby's face or hands until the end of the meal, and that can be hard if we have some neat freak parents, right? Everyone has a different style, but really allowing your baby to have food and explore different textures and flavors and really resist the urge to wipe until the end of the meal.
Yeah, I don't know about you, but for me, when we were introducing foods, I have some of the best pictures from my kid just having food all over the place. It's like the cutest pictures.
Exactly,
so
exactly.
Much fun. Yeah, so, and then about at the dinner table, should they be, you touched on this briefly, but should they be in a high chair? Should they be in a low-rise kid table? How should they be positioned?
That's also a great question. I think starting out, they have to be in a high chair to have support. I think it's important for them. As we said, some babies, if they have low muscle tone, benefit from the 5-point harness and a little pummel on the high chair and the tray. I do think, though, culturally, we do have some families that may eat on the floor and eat on a pillow or have the baby on one of the caregiver's laps, and that's fine if, we want to kind of support those cultural differences. But initially starting out, I think being in a high chair and pushing that high chair up to the table so that the baby's at table height with everyone else, watching everybody eating and just being immersed in that family experience of mealtime, which you just can't beat. Even, and as we're both working parents, we know that that's not always really easy. But I know for me, sometimes it was 8 p.m. at night, and the best advice I got from my pediatrician was, look, if you guys have to eat at 8 p.m., but you eat as a family,
eat as a family.
Eat as a family.
That's incredible. No, I love that you said that because, a high chair is important, but not everyone has the luxury of having access to high chairs, or maybe can't have multiple high chairs for multiple children. And so I think having other ways to still do it safely is very important. And I think that's where the other readiness cues are very important to make sure they're having all of those. And then if you don't have access to a high chair, still doing it as safely as possible. So absolutely love that you said that. And then I see this in stores everywhere. There's tons of different baby plates with, some will have like 3 dividers, and then there's some with like 20 dividers.
I know.
So are those plates needed, not needed?
As we know, if you just waltz down the aisle or get lost on Amazon, you can get really overwhelmed with all of the baby products. So I do think there's value to a suction bowl, right? As you know probably from your kids, if it's not, they can just toss it off the high chair tray. So initially, if you have a suction bowl and you put the food in there, and they can, work on that hand to mouth and raking, and then develop that nice pincer grasp of taking the food out of the bowl. Or you could just simply put it on the high chair tray. It's fine too. The divided plates, again, we want that sensory experience. We don't really want to divide everything. It's okay if you do use it, but I think it's better to use a bowl and then just put like 2-3 foods out there, or put it right on the tray and let the baby have at it.
Love that. Yeah, and I will say that every child's a little bit different, and a lot of this will be you working with your child and figuring out what works best for them. So my kiddo, he has autism, but he has a really hard time if the food is just on one big plate. And so for him, having the dividers actually helps him to eat a lot more and try a lot of different things. But then some children may not like that at all. And so I think learning your child and over time seeing their habits is very beneficial as well. And so every child's a little bit different.
Absolutely.
Fantastic. And then babies learning to drink. We know that some moms will breastfeed, use bottles and formula. When should they start learning to drink outside of those mechanisms, and maybe with a sippy cup or a cup in general?
Yeah, that's a great question. We get this a lot when we work with families. We know that breast and bottle feeding is very important, and at around 6 months, it's important to maybe introduce a small open cup or a straw cup or a sippy cup. Again, there's so much information on social media, and we really want to help parents sort through that. It's okay to use a sippy cup, if it works for your child and it has handles and they can learn another way to drink. I think it's important to think about putting breast milk or formula into the cup or the sippy cup. Oftentimes, if it's only water and the child only associates water with the open cup or straw, when the family goes to introduce cow's milk or some type of milk at a year, the baby's
like,
often
no.
like, no way, no how, like I've just been drinking water.
Yeah.
So, and again, variability, right, on whether a baby will do well with a small open cup. A lot of babies actually do quite well with a straw, and so trying that or something with handles. So I really feel like between 6 to 8 months, you should begin to introduce a cup or a sippy cup or straw.
Okay, great. And then with baby-led weaning becoming more and more popular, there's a lot of times where the child may not like it or they don't do well with it. And how can we make parents feel comfortable and okay with maybe their child just doesn't want to do that?
Exactly, and this is really important. Kind of as a developmental feeding specialist, this isn't for every child. And sometimes what we do is we say, we're going to do modified baby-led weaning. So we're still going to have the parent spoon feed the child, which is a really nice interpersonal experience you have with your child. You present the spoon, they open their mouth, it's a nice one-on-one experience. And we do have some children that have trouble gaining weight. And for those who have trouble gaining weight, they may actually need the spoon feeding, because maybe we're adding, some cereal that is iron fortified with puree, so getting them more calories. So if parents come in and they really want to do this, but their child is not responsive to it, no problem. We can go back to spoon feeding, or we do a modified baby-led weaning approach, which is a little bit of spoon feeding and then a little bit of that handheld soft solid foods.
Yeah, I love that. I think one of the most important things to know is that there should be no pressure whatsoever. And if your child doesn't like it or it just doesn't work for your family dynamics, there should be absolutely no guilt in not doing baby-led weaning. The most important thing is that you're doing what works for you, your family dynamics, and your child, and making sure that they are fed. And so I think having no guilt on the parents is super, super important.
100%.
Yeah. We touched on it briefly earlier, and then you just mentioned something that made me think about it, but in what areas or what children may baby-led weaning not be for them? Or maybe a child that might be a little more high risk and they should be really talking with their pediatrician about this. What types of children would those be?
That's a great question. I think babies that are born premature, again, like we said, we're looking at their corrected age and we're looking at their motor skills for their corrected age. So if they were born early, if they were born 8 weeks early, right, then they get 2 months credit. So when they're 6 months, we're really comparing them to what they should be doing at 4 months of age. So not looking at the chronological age. And as you know, at Boston Children's Hospital, we see a whole wide variety of patients. If we have patients that may have had, say, a cardiac problem and cardiac surgery, and we're really focusing on intake and calories and wanting them to gain weight, maybe this isn't going to work right now. Or children that have low tone, if a child has motor impairment or Down syndrome or cerebral palsy, we just want to support them and still introduce solid foods, but do it in a way that's safe, and maybe do a variety of spoon feeding and working still on making sure that they're getting an adequate nutrition and they're growing, and still exploring some of those early, really dissolvable baby foods.
Yeah, and I think, like you mentioned, like at Boston Children's, we have so many incredibly special children and might have some rare genetic syndromes. My kiddo has a rare genetic syndrome. And so I think, with what you were saying is, if you still really want to do baby-led weaning, every child could be on their own timeline. And so maybe the answer is not, no, it's not for my child, just not yet.
Right, exactly.
And I think working with your pediatrician to figure out when that time is best works out really well.
One thing that we'll often do in parents who really want to do baby-led weaning but their child isn't ready is something called a silicone feeder bag or a little mesh feeder bag where you can actually put a piece of solid food into that mesh or silicone bag. Do you know what I mean?
Yeah, they're really cool.
They're awesome. And then the child can kind of munch on it and eat what everybody's eating, but it really minimizes choking risk, but the child's participating and eating what everyone else is eating. So I think that use of a mesh feed or a silicone bag, if your child's not totally ready for baby-led weaning, is an excellent kind of bridge to get them there.
Yeah, I love that. And so we are so grateful to have so many listeners that tune in, and they've submitted a lot of questions. And so over the next couple minutes, we're just going to answer some of the questions that some of our viewers have submitted in.
Excellent.
And so one of the questions here is, what if my child still wants to breastfeed past 1 year of age or 2 years of age?
That's amazing.
Yeah.
Go for it, right? We love that. We introduce baby-led weaning and or spoon feeding at 6 months of age, but know that breast milk and or formula is going to be the primary source of nutrition. But past a year of age, they need to have different sources of iron and different sources of nutritional intake. But we encourage families and moms to breastfeed as long as it works for them. Would you agree as a pediatrician with that?
Yeah, for sure. I think between the mom and the baby, when they decide they're done, then they're done. But if they want to go past a year or 2 years, I think that's completely fine.
Great.
And then babies not drinking water. I've been seeing this a lot on social media. And so is it true that babies should not have water? And if that is the case, when can babies have water?
Yeah, so we get this question a lot. And I think it's only natural that parents think, oh, they're eating solid food, they need to drink water. And we know that in the first year of life, it's really breast milk or formula.
Right.
But as we've talked about, the American Academy of Pediatrics does say that babies can have a little bit of water, like 4 to 8 ounces a day between 6 and 8 months of age. Now, you never have to give your child any water. You can just stick with formula and breast milk. And as we were saying, really put that breast milk or formula into the open cup or sippy cup if they're practicing. But in some of the baby-led weaning books and podcasts and everything that's out there, they do talk about a little bit of water at the end of the meal to have the baby just wash the food down. But we don't want a lot of water because it fills their stomach, and we don't want that to fill them up and then have them not eat for calories.
Yeah, fantastic. Yeah, really before the age of 6 months old, babies should not be drinking water. Now, there may be some instances where your specific pediatrician may recommend small amounts, but that should be a discussion between you and your pediatrician, but it should not routinely be given just because at that age, children or babies' kidneys are not quite developed yet, and it could lead to electrolyte abnormalities. And so we usually say below 6 months, no water unless supervised by a pediatrician, and then above 6 months, very small amounts like you had said. And one last question, at what age should we still be cutting up our children's food and having one-on-one supervision?
Right, so always one-on-one supervision, whether that's mom, dad, nanny, babysitter, grandparent. We always want one-on-one supervision at meal times. And in baby-led weaning, we talked about a lot of soft stick-shaped foods. What we don't want is any circular or cylindrical foods, such as if we're cutting things, we want to cut them lengthwise, and circular foods like cherry tomatoes and grapes should be quartered, and no giving whole nuts like cashews or peanuts or anything like that. Be very careful with gummy fruit snacks and things like that. And really up until 3 years of age, we have our list of high choke foods that we recommend that families avoid.
Yeah, and people always ask me when I'm going to stop cutting my child's food, and I say when they're 18.
Yeah.
So I would say it's completely okay to keep cutting it.
Yes, absolutely.
Okay, great. Well, Cara, I cannot thank you enough for sharing your expertise with us and answering all these questions.
Thank you so much for having me.
Thank you again for tuning in for this episode of Answers for Families. Make sure to check out all of our social media channels where you will be able to stay closely connected and not miss a single episode. Also, check out our Answers blog where you can learn a lot more tips and tricks.